Wait till it comes before I leave you. So it comes up with live, but nothing's come up on the screen. Oh, it just says live at the top, yep, but nothing's on my screen.
It's working at my end, I think.
I can't see anything here. Should I push anything?
Looks like it's working, so you can't see anything.
No, I can't. I've just got down the bottom, finish, and I've got live at the top. Yeah, okay. Ah, wait. Now I've got it. Can you see me now?
It's just black at the minute. It's probably just going to take a little minute.
Because I can see myself now.
Okay, that's good. If you can see yourself, it must mean
I know why it was back, because I didn't have it reversed. That's why I was looking at the cover of it. Simple things. Yeah, okay. Good. Oh, that's fantastic. So I'll hang up my phone now. Now, is that background okay in the lighting?
Yeah, it hasn't come up for me yet, but I'm sure.
Okay. Jeffrey Ponting, yes, says yes. And Emily says can see you.
Oh, good. Okay, good. All right, we're good to go.
Okay. Shall I start now?
Great. Yeah, go for it.
Right, sure. Thank you. Good.
Bye.
Thank you. Hello. Good afternoon. Managing asthma during the COVID-19 pandemic. My name is Dr. Jenny Gowan. I'm a consultant pharmacist working in aged care homes, doing community medication reviews, plus sessions in community pharmacy. I'm a member of the National Asthma Council writing group for the Australian Asthma Handbook. I'd like to acknowledge the traditional owners of the land on which we're meeting, pay respects to their elders past and present. So my subject for the next 30 minutes is managing asthma during the COVID-19 pandemic. And I hope to offer you some practical tips to keep you as safe as possible. Thanks very much to Lisa Connick and Kathy Pekanis from Asthma Australia, who will be working with me. Please send in your questions and we'll try to address them. I don't have all the answers, but hopefully we can point you in the right direction. So Asthma Australia has given me some questions to start today's session. Firstly, there's not enough evidence to know just how COVID-19 is going to affect people with asthma. Experience with other acute viral infections indicates that if you're infected, people with asthma may be at greater risk than the general community due to your underlying disease. However, the preliminary reports from some of the other countries with high infection rates do not suggest that the virus is associated with increased risk amongst children with asthma. So my first question today was, a lot of you are having trouble getting medicines through the pharmacies. Unfortunately, it's like the toilet rolls. People have been stockpiling. The pharmacy where I work is out of some of the preventers, such as your Seretide, your Symbicort. They've got some stocks of Briolipta and some of the other preventers. But each pack of that preventer is designed to last 1 month. So if you're getting low, let your pharmacy know, and many have set up waiting lists and will let you know when the stock arrives. So you should probably try and have a month's supply in advance, but you don't need to go excessive. Unfortunately, we're out of Ventilant, but there are other brands such as Asthma and Aramar. Ventilant comes from the UK, but Asthma comes from Brisbane, so that hopefully the supplies might hold. So advice from the TGA yesterday says that there was plenty of medication in Australia and stocks are being replenished. So I hope that you can get what you want. But unfortunately, many people who do not have asthma are stockpiling the blue inhalers, and that is a concern with it. So asthma has got an overuse of the blue inhalers. If you're needing to use it more than use a blue inhaler, so you know what I'm talking about. So unless you are diagnosed with it, then you shouldn't be, with asthma, you shouldn't be taking it. We've got an overuse. And if you are using the blue inhaler more than twice a month, it used to be twice a week, on a regular basis, then you need a preventer. The only time that would be an exception is if there's a respiratory tract infection, that's the main trigger, or for exercise-induced asthma. So it should be used infrequently, no more than twice a week, if everything being equal, and a maximum of 3 of these inhalers per year. Each inhaler has got 200 doses, so that's a fair amount. So if a person is using it more frequently, then a preventer is indicated, either a low-dose inhaled corticosteroid. Often a lot of you just call them as steroids. That's your fluticasone, propionate, or your furiate, or your budesonide, or your cyclosinide, and it should be taken once or twice a day depending which one. Or there is a combination one which contains a low dose of the corticosteroid, budesonide, and formoterol, which is a longer acting agent which opens up the airways. These agents have to be prescribed by your doctor or your nurse practitioner. This is known now as MART therapy, maintenance and reliever therapy, where you just have the one inhaler which contains a combination of medicines to help your asthma. So these products sound confusing because there's so many of them. If you look at the Australian Asthma website, and you can see here I've got a brochure of all the different types of inhalers that are around. So get onto the website and you can have a look at all the various types. So the use of the inhaled corticosteroids has been raised in the media, but it is seen as safe and front line in the management of asthma with COVID-19. So asthma is a chronic inflammatory disorder of the airways. People with asthma experience episodes of wheezing, breathlessness, and chest tightening due to the widespread narrowing of the airways with it. Remember that we have deaths from asthma at every year. In 2017, there were 441 deaths in Australia. Thank you for that. I will try and speak a bit slower. I really appreciate that. And I note that there's a question that some people prefer Ventilant over Asthma. They are seen as equivalent, and I think it's generally up to your own preference with it. They are able to be exchanged, so no problem with that. Use either one. They both are going to actually act as a broncho, relax your muscle when you're actually having an asthma attack. Okay, so of the deaths, of the 441 deaths, ladies over 75 were the highest group. Okay, so somebody has said, I take Symbicort and that has got both in it. You take it every day. Yes, and that's a really good way to go, because here's your airway. Let's pretend that my hand is an airway. It's closed over. If you have your short-acting agent to open it up, your reliever, it opens up this part. It opens up the muscle, but it doesn't actually open up, it doesn't do anything for the inflammation. On the inside we have the mast cells swelling up and we have the mucus. So when you are taking the combination of the MART therapy, the maintenance and reliever therapy, you are looking at the inflammation. The same thing occurs if you're using the daily inhaled corticosteroids and then just use your salbutamol as a rescue treatment. Okay, so salbutamol, Ventilant, over the counter, available in Australia, and continues to be controversial. I think it's a good thing in many ways, but we do need to use it with care. The availability has led to much discussion by the respiratory specialists. Whilst it's convenient, we have the over-reliance on these blue inhalers, with many people using it and only treating the symptoms as I explained. There's a recent paper published in the British Medical Journal by Helen Riddell and others of about 2,700 people with asthma, and it found that nearly 40% had only used a blue reliever puffer, and 1 in 4 of these people needed urgent treatment for their condition in the previous year. So without the virus, we've still got big problems in the management of asthma to keep you safe in Australia, and this gives us an extra alert to really manage your asthma to get your best quality of life. So what about the Ventilant? Yes, you can request it from a pharmacy, but only if you've been diagnosed with asthma and you have it on your pharmacy medication history. So people with products such as Brio Ellipta, or your Seretide, or your high-dose Symbicort, or your, I've got to find it, but these ones. Now, these ones, because you've got an agent, formoterol, that acts as fast as the blue inhaler, you can use that in emergency, but you need to check with your doctor for your emergency plan. With agents such as this one and some of the other ones, also, you will need to have the blue inhaler for your action plan. Okay, I know it's confusing, so talk to your pharmacist about it over the phone or in the pharmacy if you're going in, or get onto the Asthma Australia website. Okay, now have a question on the biologicals, and I will deal with that as we get down a little bit later, if you can just hold to that one. And certainly it is safe and it should be used. You should continue to use that one. Okay, so we need to think about the action plan. And if we look at some of the studies on the self-reported data, about 1 in 4 people aged 15 and over with asthma had a written action plan on self-reported data. So do you know what to do in emergency? You need to either have your blue inhaler or you need to use your combination MART therapy. If you're using your blue inhaler, you'll use it with a spacer, and I'll go through that in a moment. Okay, so technique. Unfortunately, many people do not use their inhalers correctly, and many people have not been shown correctly how to use them. So there's excellent videos on the Asthma Australia website to help you with that. So one of the simple tips I'd like you to take away is to use only one puff at a time. Then wait for a few moments for the second inhalation. It will penetrate better. If you can imagine, your airways are like a tree. You can turn the tree upside down, and you want the air going right out to where the leaves are and the branches and the flowers are. So to start off with, you need to give chance for the muscles to relax. So one puff, and then if you wait a couple of minutes before you have the second puff, you've got a chance of better penetration, and that will travel along the airways and get to where you get the oxygen exchange. So just to go over the tips of using your common correct device, and we've got a posting up from Asthma Australia. It's all on the website. It is a fantastic website. It is something you can really do in the extra time, is really drill down and see all the things and know how to use it. So just a reminder about this. First of all, remove the cap. Check the dose counter if it's one with the dose counter on. The blue inhalers don't have that. Hold the inhaler upright. I'm following through my instructions so that I don't miss anything, even though I do it very frequently in front of an audience. It's somehow a bit different doing it this way. So I'm going to breathe out gently, then away from the inhaler. If I haven't used this for a while, I might puff one into the air to make sure it's going. Yes, it's going fine. I'm going to put it in my mouth without biting. Then I'm going to breathe in very slowly through the mouth and at the same time breathe down. You should count to 5. I actually counted to 10 then, because when I'm demonstrating it, people think, oh, I don't know if I can wait that long. So at least you need to hold it for about 5 seconds or as long as comfortable. And then gently breathe out away from the inhaler. Then wait a few minutes before you do it again. Replace the cap and keep it in a safe place. A safe place is not the car. It gets too hot. But I'm very happy that if people are doing sport, when we're able to exercise again, that they have the blue inhaler in their sports bag. They have one at home and they have one in their school bag or whatever for an emergency. So that's all on your asthma action plan with it. So, but children, little children should use a spacer. And here we have a spacer. So the spacer works so much better. And everyone who is using an inhaled corticosteroid, I really like to use a spacer with it. So the spacer is very easy to use. This is actually an Asthma Australia spacer. It was really good. So we put that one in, and we don't put it in now and say, when you've had your cup of tea, have it. And I've seen people do that. We actually put it into the mouth like so. And you look an absolute dork when you do this. So please, apologies. Now I can have a rest. Okay, so it's 1 puff only and then 4 breaths. If your prescription has got 2 puffs twice a day or 2 puffs every 4 hours, you still do 1 puff and then do it 1 at a time. Now, if you've got a little child, you might get a silicone spacer. And the little silicone spacer works extremely well. I'm not going to inhale more of it now, but you can see. Not only can you can hear it, you can actually see it going in and out. This is also very useful for people with disabilities. Obviously, you need good hygiene with the masks, and with the spacers, use a spacer that is non-static. Then it can be used straight away. And again, that all is carefully detailed on the Asthma Australia website with it. So for hygiene purposes, if somebody has got an infection, I would like it washed more frequently, but generally once a month is sufficient. Pull it apart, put it in warm water with detergent, and make sure that it's clean there, and do not rinse it. Leave it then to air dry like so. Don't use any tea towels or paper towels on it, because you're going to get particles, and that's what you're going to actually inhale the next time you use it. So spacers are one of the best things out for the use with metered dose inhalers. They increase the efficacy of the metered dose inhaler from about 18% to about 30%, depending which paper you read, but quite significantly. And once people that I've convinced to use a spacer, they say, I have felt so much better with that one as well. So everyone with an inhaled corticosteroid should use a spacer, and all children should use a spacer. And obviously in emergencies, a spacer is the way to go. So again, it's 1 puff, 4 breaths, 1 puff, 4 breaths, repeat 4 times, then it keeps on going for the 4 times. If you don't have a spacer and you're out, you can use things such as a polystyrene coffee cup. That is if you're out, and it may not be in this environment as well. So here we have the instructions from Asthma Australia on the website so that you can revise that later. I find adults need to hear something and then read it and then actually assimilate it very well before you actually understand it all. So what else can you do? Flu vaccines, immunisation as soon as possible from either your doctor, your pharmacist, or your practice nurse might do it as well, or your nurse practitioner. I went and had mine on Tuesday this week, and the safe distancing was in place. I was really lucky. I got to the clinic and there was nobody else there, and it was all set up absolutely beautifully. By the time I left, there were quite a number of people. But the surgeries are very particular about this, as are the pharmacies. So should be no problem in having your influenza vaccine. If you're going to go into a nursing home and you've got a relative there, you cannot go unless you have actually a certificate to say that you have had the influenza vaccine with it. So we need safe distancing in the GPs and also in the pharmacies. Now, if you have run out of prescriptions and you do not want to go to the doctor at present, we can actually advance a 1 month supply, but it's not as a PBS item, it would be as a private item. So some of the other issues I'd like to address are the use of nebulizers. It is much more preferable to use the metered dose inhaler and the spacer, because the nebulizer spread droplets, possibly containing the virus, into the air. It'll go for several meters and it will stay airborne for 30 minutes to up to 3 hours. Then the droplets land and they remain active on stainless steel for 24 hours and up to 48 hours actually on plastic. So the Thoracic Society have just put out a statement on this, and they've also suspended spirometry testing in most cases at present because of the high risk of contamination with it. You don't need, at this stage, we're not sure whether you need a booster. There's a question about that because it could only be lasting for 3 to 4 months. So it certainly is something depending on your risk factor, and I would consult with your doctor at the time with it. If for a child, again, you need to consult with your doctor as to what is their risk with it as well. There's been a few media concerns about some of the medications that might be a concern with COVID-19. I'd like to address whether we should be using ibuprofen, what about the blood pressure medications, and what about the oral corticosteroids. So my name is Dr. Jenny Gowan. I'm a consultant pharmacist, and I'm here for Asthma Australia to try and help you manage your asthma as safely as possible during this epidemic. So let's address ibuprofen. Could it worsen the health outcomes in COVID-19? At present, there's not enough evidence to suggest it may worsen the outcome, but about 3 to 11% of people with asthma may be sensitive to aspirin and what are called non-steroidals. That includes agents such as ibuprofen, known as Nurofen, diclofenac, Voltaren, Mobic, meloxicam, Indocid, and many others. These people have what is described as aspirin-sensitive asthma, and their asthma will get worse when they actually have the non-steroidals. So a very small group of those people. The other people I would be worried about with ibuprofen are pregnant ladies. It shouldn't be used in the third trimester of pregnancy. And the other group are the people with cardiovascular concerns. It will increase the blood pressure, they can cause fluid retention, and if you've got reduced renal, kidney or liver function, may not be a good idea. If you have got gastrointestinal problems, they can be quite irritant to the tummy. So those group of people should really avoid agents such as ibuprofen. If you're concerned, then you can use paracetamol in the correct dose. A few weeks ago when I was working, we had panic buying on paracetamol, and we had no paracetamol mixture in the pharmacy and no paracetamol tablets. That has now ceased, thank goodness. So let's hope that we can be sensible and only having what we need. Now, what about the ACE inhibitors or the angiotensin receptor blockers? Agents such as perindopril and irbesartan, and they come as various brand names as well. There have been some early concerns about the association of COVID-19 and hypertension, but in particular with these agents. There's a lot of papers being published right around the world for it, and there's insufficient evidence at this stage. In fact, there was a paper that came through my computer last night to say that they may be of benefit. So the message is, do not stop taking them. In answer to your question about the dose for the flu shot, there is a different product for children, and there is a different product for people over age 65. And again, your doctor will be the person to talk to about for children and for the older people, how to get that the correct injection for that, so you've got the maximum cover. So corticosteroids, and we're talking about here the oral corticosteroids, the prednisolone, the dexamethasone, etc. So a lot of people are using prednisolone when they have a minor flare for asthma. I would suggest that you should only use it if you've been assessed by your GP and your specialist, and you can certainly do a telephone consult on this. You need to have somebody to assist you to manage it if you are feeling that you need to use it. So please use it only when indicated, and we need more information on this as to its effect with COVID-19. So check first before you do it as well. I've got a question here about the update on the supply of Flexitide, that's fluticasone propionate. It says here that their pharmacy hasn't gotten it, that their supply is out. I would perhaps go round or phone round other pharmacies in your area to see whether there are supplies, because there was some filtering through, but I don't know quite how long it's going to be at this stage. I said I would speak to the lady who sent a query about the biologicals. I've done a literature search on this. There's very small numbers, and it appears that at one stage there was a decreased eosinophil count, and that might be due to the results of a severe COVID-19 infection, not necessarily the biological agent, the omalizumab, the mepolizumab, or the benralizumab that you are taking, but you may get a reduced immune response. So again, I would be consulting with your respiratory specialist, and the general advice is to continue taking your biological agent at this stage. Right, we've got somebody here that has got very unstable asthma for the last month, and staff put me on prednisone for the last 3 weeks. That seems a long time, to be honest. I think it's time to go back and get a reassessment of your asthma. I'd also like to make sure that you are doing what you can to avoid trigger factors, particularly things like smoking. It might be animals that are setting you up. We're not in the peak hay fever time, but I've noticed that I've had a bit of hay fever the last couple of days. I'm usually expecting that more likely in spring. So I think you need a consultation with your doctor sooner rather than later. Thank you. So in summary, I think I'd just like to summarise and say the importance is to know what to do in an emergency. Have your asthma action plan, get on the Asthma Australia website, have a look at those, talk to your doctors, have a phone consult, can be updated by phone. Continue taking your inhaled corticosteroids, rinsing your mouth out after, I forgot to say before. Do not use nebulizers unless unavoidable. And carry your salbutamol, your tibutylene, or your low-dose budesonide formoterol with you. There's also another product on the market, that one, Spironex as well, which also can be used. Carry that with you if you are going out to an appointment. In an emergency, know what to do. Use your spacer, and it is 1 puff, 4 breaths, repeat 4 times. This poor lady that hasn't managed to get the Flexitide, is it for you or is it for your child? Again, I would be contacting your doctor, because there are other alternatives and we can see what is available, and we might need to switch to another agent with it as well. Good luck with it. This makes it really, really challenging. I had one of the doctors ring me yesterday with a similar situation. Okay, so minimize the triggers. Stop smoking. Hay fever. If people have got perennial hay fever all year round, they should be using an inhaled nasal corticosteroid to protect the nose. It is a united airway disease. Got the same passages, go down from the nose, down to the bronchioles, down to the lungs. So if you have got ongoing hay fever, allergy, we need to treat that. If it is just seasonal, then we use it only over the seasonal times. So the inhaled nasal corticosteroids are the way to go. Just as a matter of technique with it, blow your nose first. You can use some of the normal saline type products to clean out the nose. Right hand into the left nostril, left hand into the right nostril, so that you're aiming to get this spray going here, not up here, because that's when you get your bleeding noses going. Okay. And the last thing I'd like is influenza vaccine and pneumococcal if you're over 65 or if you're otherwise indicated. So, know your asthma triggers. Again, there's a whole lot of it, and there's lots and lots of triggers that time doesn't allow me to go into today on the Australia Asthma website. So stay at home, wash your hands, and please keep safe. It is challenging times for us all. I'm in isolation myself, but I seem to be working harder than ever from my home office. Thank you.